Dr. Parikh with Regen Medical. Today I wanted to talk about carpal tunnel syndrome. So carpal tunnel syndrome is essentially a pinched nerve in your wrist that can cause numbness, tingling, and even weakness in one or both hands, even to a point where people drop things or have difficulty picking up things. But a big part of whether a numbness, tingling in your hand is carpal tunnel is, of course, diagnosing. And you got to start with a good physical exam. You need to really figure out, is it really coming from here or is it coming from up somewhere above? So physical exam is certainly one. Diagnostically, there's something called a EMG that can look to see if the nerve is really getting pinched through there. From a treatment standpoint, a lot of times we'll talk about using some splints in your wrist. Therapy is certainly a good idea as well. But even before that, we have to look at why did this happen in the first place? From a standpoint of the mechanics of how you use your neck, your shoulder, your elbow, all the way into your hand. And that definitely takes some looking at your day-to-day environment. You know, a lot of times we'll say people work at computers all day long will get it. But it's not that simple. So you have to look at the posture that you have. So if you're forward like this all day long versus if you're sitting up nice and tall, the height of your chair and your desk can make a difference as well. You know, kind of what are some of the muscles up in your shoulder and your elbow doing that may be contributing to what's going on over here. So again, you want to look at the mechanics. You want to look at potentially using some splints. You want to look at therapy. And then there's non-surgically some nerve blocks that you can do as well that can really free up the nerve. And then of course there's surgically, which works for a lot of folks. But again, if you're not addressing some of these biomechanics, it actually can come back. Diet is also big. I talk to almost every one of my patients about eating enough protein, drinking plenty of water, proper vitamin supplementation. So hopefully you don't have to deal with this, but if you are and you need some help with it, certainly give me a call. Thanks.